afternoon and warm welcome to this special interview. My name is Anoop Verma. I am the editor of ETGovernment, which is a vertical of the Economic Times focused on covering government initiatives and policies. Today, our guest for this special interview is Professor Rabinarayan Acharya. He is the Director General of Central Council for Research in Ayurvedic Sciences, CCRAS. CCRAS is an autonomous body under the Ministry of Ayush, Government of India. It is India's apex body for undertaking, coordinating, formulating, developing, and promoting research on scientific lines in Ayurvedic sciences. I come to you, sir. What are the key achievements of CCRS in promoting research and development in Ayurveda products over the years?
Thank you, Anoopji, and thanks for giving me the invitations for this prestigious interview. CCRS, as you told in your introductory remarks, is the pioneer organizations under Ministry of Ayush to promote research in the field of Ayurveda. Since its inception, it has made many contributions, and the product development in particular, it has contributed in a different way. But in terms of product development, what you have highlighted, product development, CCRS works in two ways. In the sense we have some class according to Ayurvedic Pharmacopoeia of India, certain classical formulations are there which are mentioned in our pharmacopoeias. What I can say in the layman language, what are mentioned in Charak Samhita, Susut Samhita, Ashtanga Hrudaya, Bhaishaj Ratnavali, some 54 scheduled books are there where these formulations are noted. CCRS till now has developed near about 160 classical formulations of these types. Their safety, their efficacy, their clinical efficacy in terms of different disease conditions, particularly in 36 different disease conditions. CCRS has developed through a structured way of drug clinical trial, and not only carried out all these things, but also published in different disease, different well-known journals. And till now, we have worked upon what I told you that near about 160 classical formulations. This include the respiratory disorders, musculoskeletal disorders, mental disorders, women's and child health, and eye diseases, skin diseases, anorectal, and particularly the iron deficiency anemia. We have classically formulated drugs. We have prepared we have our own preparations methods, and we have prepared it. We have standardized it, and we have carried out the clinical study. Then another part of this drug development is some new formulation development of new formulations. So CCRS is working on that aspect also, and what we call it as a coded drugs. You can recollect the name of Ayush 64, Ayush 82 in terms of Ayush during COVID time. So these are Ayush is a code of CCRS. Whatever research product we develop, we used to code that in the terms of a name of Ayush. And till now, CCRS has worked out different activities near about 25 such type of coded drugs CCRS has developed, and these coded formulations are being researched upon on geriatric healthcare, dengue, migraine, hypertension, cancers, quality of life in cancer patient, then bronchial asthma, chronic filariasis, lymphedema, and occupational stress, drug-induced liver damage, and non-alcoholic fatty livers, women and child, different women and child health concerns. So in this area, CCRS has developed new formulations and carried out all the three phases of drug development: preclinical, safety, efficacy, and also large-scale clinical trials. You can recollect and also notice that CCRS has transferred the technology of many of these formulations to different companies through NRDC, that is National Research Development Corporations, and 12 technologies in the recent past has been transferred to different companies, such like Ayush 64 for malaria, Ayush 64 for mild COVID-19 symptoms, Ayush 82 for diabetes, and Ayush SG for rheumatoid arthritis. So this type of works CCRS used to work for drug development procedures.
Ayurveda has traditionally been very popular here, And after the efforts of CCRAS, I think it's getting more and more popular. And this Food and Safety Standards Authority of India, FSSAI, has formulated Ayurveda Aara. So, what are the key features of this product? Of a product that so that it can be included in this category of Ayurveda Ahara.
So Ayurveda Ahara, as you told, sir, this is a new term, not a new term, but it is a coined term for marketing of this different types of dietetic items. Because as you know, the purpose of Ayurveda is swastasya swasthya rakshanam aturasya vikara prasamanam. That is, to prevention is the first and primary aim of Ayurveda. To fulfill that, we have different ahara kalpana. That is pathya, what we call as pathya kalpana also, which can make a person healthy. And these pathya kalpanas are generally prescribed during some disease conditions and post disease conditions also, to prevent. And also after a man suffered from certain disease conditions and he get cured, then also the pathya kalpana, he or she should be remain in pathya kalpana, and so that he can recover quickly, and that purpose also. So in this way, under the banner of Food and Safety Standard Authority of India, Ayurveda Ahara is one component there now. And these are particularly particularly four to 5 points are being considered when these tips are given. First is the ingredients. The recipe and ingredients specified in the section A of authoritative books should predominantly consist of ingredients traditionally used in Ayurveda, such as herbs, spices, and natural substances known for their health benefits. So we can't use anything other than not mentioned in the scheduled books. That is the first thing. These things must be whatever used in Ayurveda, Ayush, Ayurveda, Ahara. Now it's somebody many noted as Ayush Ahara must be in the scheduled books. Then it must have some health benefits. It should offer specific health benefits according to Ayurveda principles, promoting overall well-being and balance in the body. It should not claim that by taking Ayurveda, Ahara, this disease will be cured, this will be all these things. No claim in the, but for health benefits, it must have preparation methods. And particularly, that will be considered under Ayurveda Ahara. It should be specific preparation methods and should align with the Ayurvedic principles, emphasizing natural processes and avoiding excessive processing or artificial additives. These are the things there. And also the quality standard. The product must meet the quality standard set by FSSAI to ensure the safety and the efficacy. And another is labeling and the packaging. The clear labeling and packaging should be affect the Ayurvedic nature of the product, including relevant information about ingredient and their health benefits. So these are the things which should be followed, and the dietetics items to be considered in the Ayurveda Ahara.
So, are you getting good response from the manufacturer of Ayurveda products?
Yes.
Regarding this.
Many you can see in this health melage or whenever we are putting the Ayurveda stalls, a heavy demand from the public is there, and many companies are now coming towards this Ayurveda Ahara, and pharmaceutical companies are coming to Ayurveda, and many are available in the market. CCRAS is also working on that, and we are working with National Institute of Nutrition for development of certain product, and we have already registered some under FSSAI for this category.
Okay. A lot of innovation in Ayurveda is being done by our practitioners all over India. So CCRAS has started a program called Agni, Ayurveda Gyan Nipunya Initiative, for promoting the innovations by local Indian Ayurveda practitioners. So how does this initiative promote the innovations of Ayurveda practitioners, and what kind of response you are seeing from the practitioners for registering their work in this category?
Sir, this is a new initiatives of CCRAS under Ministry of Ayush directives, that how to involve the physicians in a research mode in that. That is the thing that we are we are teaching the students under the college educational system. We are teaching, we are giving training to the research fellows for research purpose. That to make the physician, as you know, that Ayurveda is one of the most ancient system of medicines, and many many physicians do practice based upon their own innovation, because Ayurveda gives that liberty that it is up to the buddhi, or up to the mental condition or thinking capacity and yukti justification, that a physician can formulate new formulation based upon the drugs. And in the recent practice, many new disease conditions are also come up. Many new disease conditions. Take an example of COVID-19, which is not noted in the classical text of Ayurveda. And many modern diagnostic disease conditions they are there, which are not noted in the classical text of Ayurveda, but they are being practiced, they are being well managed by the Ayurveda physicians. So to make those type of claims in a scientific way, CCRAS has come up with the proposal Agni, that is Ayurveda Jnana Naipunya initiatives. Whatever the Jnana, whatever the Naipunyata among the physicians are there, it may be in terms of new drug development, it may be in terms of new equipments or instruments which they are being practicing for the management of disease conditions which are not noted in the classical text of Ayurveda, which are not practiced previously, and also any new indications of the formulations. New formulations they prepare, but old formulations, but having new indications. They have a huge type of information among our practitioners, because as you know that we have more than 295,000 practitioners, Ayurveda practitioners in the country, and so to make them aware about it, we have taken these steps, and we got in a first circular. With a short notice, we got a good response. Near about 50 physicians have shared their views. That yes, some have shared that yes, this is a good instrument I am using for this managing this disease, some conditions disease conditions, and also some are using new formulations, new indications. So we are now going, we have scrutinized it, and we are going to have a brainstorming session with them, and take CCRAS which handhold them by in terms of financial support we are going to provide, but the research attitude among them, how to do this clinical research work, will take them, and all the benefits will be given to those physicians who has shared their knowledge to us. Their knowledge will be protected as per the present law, and we are going to have collaborative research works along based upon their experience with Institute of National Importance. In the first question, you have asked me what are the product we have developed. We have developed all these new product, and we are also working with organizations like ICMR, AIMS. So all these organizations of repute, we are working with them to prove this product in a scientific way.
Okay. So you must have done some survey to find out how many Ayurveda practitioners are there, because Ayurveda has been practiced in this country for a long time, for ages. So how many of them are there, and what kind of procedures do you follow to register these Ayurveda practitioners and ensure that they are well trained and they are providing the medications that are approved by the government or your entity, your organization?
Thank you, sir, for this question. This is a much needed questions that many times people do say that Ayurveda is a traditional system of medicines, it is not being regulated, anything else like this. And because that is a quite different definitions, because in the worldwide definition of traditional medicines and Ayurveda itself, because Ayurveda is a science being practiced in India 5,000 years, since last 5,000 years. It has its own publications, own books, own fundamental principles. But whereas the traditional system of medicine is practiced in many countries, they don't have this type of fundamental principles, or they don't have any published find literature since many ages there. So here in India, Ayurveda, not only Ayurveda, but all Ayush systems, Ayurveda, Unani, Siddha, Homeopathy, Shwarippa, all are being regulated. All are being strictly regulated by the Drugs and Cosmetics Act there is, and we have the regulatory body, National Commission of Indian System of Medicines. There, every Ayurveda practitioners is being registered. As I told, as on today, there are about 2,95,000 practitioners being registered in different states. As we all know, state health is a state policy in Government of India structure. So they are registered in the respective states under different designated councils, and they are when a physician is going to be registered in a registered council there, that board, registered council or board, he or she must be educationally qualified. There are strict guidelines. There are the guidelines who should be registered themselves. So all are now providing educations and training in a bachelor course, what we call Bachelors of Ayurvedic Medicine and Surgery, that is BAMS. And this registrations is renewed every 5 years. There is a provision, and recently the NCISM has in 2023 December 28 December has issued a gazette notifications where all these rules and regulations are being noted, that a registered practitioners every 5 years he or she has to update his knowledge through different continuing education programs, and they have to minimum score 50 score there, so that they can update their registrations, continue their registrations. And this score must what we call must continue in terms of attending seminars, conference, publishing research papers, and all the 50 that score will be given to them. So those who qualify minimum 50% score, they will continue their. So these are the provisions where to make the Ayurveda physicians updated, time-oriented knowledge to them, and through different training programs. These are the provisions made by Government of India in the Ministry of Ayush.
But if you are renewing their registration every 5 years, so does it not damage their enthusiasm for further research? So how can they make significant investigation in opening a clinic or doing this if there are chance that their registration they might lose their registration in 5 years?
No, sir. They won't lose the registration, sir. Because because science is always a progressive, and so also the medical, and so also the Ayurveda. Every time, every year, every day, we have near about 100 of publications coming up about drug research and herbal drug research, which is worldwide. So every physicians, it is the duty of a physician to upgrade his or her knowledge, so that every 5 years, they're not very stringent. They have to attend some continuing medical education program. So they've attended, they will get 10 score. If they are attending some seminar conferences, they will attend 10 marks. If they wrote an article, they will get. If they got a patent, so they will get 10 marks. So in this way, they will get the score, and every 5 years. So it is a compulsion. It will become so that they should attend new seminars, new conferences. They can present their research papers there. So for that purpose, it is also in a modern system. Also, this system is being prevailed, and so also the Ayurveda. NCISM.
In 2023, CCRAS celebrated Ayurveda Day with the theme Ayurveda for One Health. So there is some effort being made to make it global. In other countries, there is a lot of interest in Ayurveda. So how much progress did you make in promoting Ayurveda around the world on this Ayurveda Day?
Sir, Ayurveda Day was celebrated this 8th Ayurveda Day, where CCRAS was given the responsibility to coordinate across the country for under Ministry of Ayush. So there are near about 21,000 activities were carried out, and where near about 18 lakhs people took part in this different activities. And we have uploaded a tagline, that is I support Ayurveda. Near about 15 crore people like this I support Ayurveda. So that shows the huge interest among the public about the Ayurveda. And another thing in this Ayurveda, as you know, as we all know, there are about 100 countries across the globe Ayurveda is being practiced. And this 100 countries, so from there, and Ayurveda, for the tagline was there. This year, the theme was that Ayurveda for One Health. So it in One Health includes the environment, One Health includes the animals, all these things. And Ayurveda has a own Ayurveda based upon its own fundamental principles. That is the main fundamental. One of the main thought process is Vasudhaiva Kutumbakam. And that is whole universe is one, and also Yat Pinde Tat Brahmande. Ayurveda takes that principles also from yoga, and Ayurveda also takes the same principle. Whatever in my body represents the universe, so that in many conditions, Ayurveda always say that preserve the environment, preserve the universe, so that the health will be preserved. So that condition, so here in Ayurveda Day, we have different activities we have carried out near about in the 90 countries. Online activities were carried out about Ayurveda Day celebrations through Ministry of Ayush. So there is a huge impact on Ayurveda, utility of Ayurveda, and particularly Ayurveda for One Health in terms of veterinary. Many veterinary colleges, many other organizations, Kerala Ministry also, under different ministry, different activities has been carried out for Ayurveda. So a huge impact of celebration of Ayurveda Day each year, and this year also it has impacted a lot.
This year also, I think you'll be celebrating in the same month.
Yeah. So we have the fixed date of Dhanvantari Jayanti. So there, in that day only, the ministry decides, then we follow that.
Okay. These days, people have become very conscious about the kind of food that they eat. And the Ministry of Ayush is aiming to grow the global Ayush diet market to about rupees 100 billion. So how much growth are you expecting in Ayurveda superfoods category?
Sir, it is a superfood category. Ayurveda superfood is poised a significant growth within the border of Ayush diet market, which Minister of Ayush aims to expand to 100 billion. Consumer interest in the healthy foods and drinks, particularly those incorporating Ayurveda herbs, is on the rise with 34%. You can see 34% financially healthy consumers are taking that part. And there is another CAGR report that near about 16% growth in 2025. So in this way, there is a huge scope of and there is a demand, internationally demand, and particularly the activities being taken on post-COVID demand of this the public, about awareness of the public about the positiveness of Ayurveda. Definitely, the target fixed by the ministry will be achieved.
So how are you using digital technologies for improving the quality of research in Ayurveda products? Because now the research we have the opportunity of using digital technologies to do all kinds of research that was not possible earlier. So how has it impacted the research work? And also, how are you using these technologies to promote Ayurvedic food and medicines around the world?
Sir, technology is the need of the time, and Ayurveda has not only adopted that, as also implemented that in many aspects. And how Ayurveda has implemented the digital technology, because it has a tremendous potential, and the ministry is working, not only the ministry but also all its subordinate organizations are working for this digitalization of different aspects. So say the start the first from Ayurveda has its own fundamental principles, what is the Prakriti. So the assessment of the Prakriti, we have digitalized the platform, digitalized the format, and we are collecting the information in a digital mode. And also all these recent development is that there is a portal, that is Namaste portal, where all these informations about the equivalent English word about the disease conditions, morbidity codes are being noted in this Namaste portal. And not only in India, but also Ministry of Ayush has come up with this ICD 11, so that internationally, how the Ayurveda term, not only Ayurveda, Unani, Siddha, the terminology are being accepted international way, that has been taken care of. And CCRAS in particular, under the ministry guidance, has many web portal we have developed. We have developed a manuscript web portal known as Ayush Manuscript Advanced Repository, what we abbreviated as AMR, where all the manuscripts available. As we all know, Ayurveda is ancient science, and we have many literature available in a physical format in form of manuscript. It may be a palm leaf manuscript or it may be a paper manuscript, but we have taken steps to make them digitalized and available for research purpose. For this purpose also, we are putting MOU. Recently, we have started an MOU with Central Sanskrit University, so we are collaborating work for that manuscriptology digitalization purpose also. We are also digitalizing the inscripts available India and worldwide under a project known as Showcase of Ayurveda Historical Imprints, that is SAHI. So here, all the imprints available, inscriptions available across the India from different places where the Ayurveda health informations about how Ayurveda was a part of public health thousands years back. It is being collected and put now being kept in our website, being hosted by our National Institute of Medical Heritage, Hyderabad, under this SAHI web portal. And also, CCRAS has kept all the research activities in the Ayush research portal, and also eMedha research portal is there, which keeps the catalog of all these things. Additionally, the Ayush research portal, that is ARP, serves an index of scientific publications of the Ayush system. So all these informations are now available digitally there. Excluding that also, we are working with CDAC Pune for this electronic health record standards, and also different organizations. We are now developing, CCRAS is coming up with a new project that is digitalized retrieval application of versatile yardstick of Ayush substances, what we have abbreviated as a Dravya, where updated informations about the substances, or it may be a medicinal plant, it may be metal, it may be mineral or animal product, about A to Z information of those things will be available digitally for the research purpose, for the medical purpose, and they will be updated information about all these drugs will be available for the global people. So this will definitely help to disseminate the Ayurveda knowledge among the public, particularly this digital world, through this digital platform.
Thank you, Professor Acharya, for your answers. You have given a really good introduction to what Ayurveda, what steps you are taking for promoting Ayurveda and how research is developing. Thank you.
Thank you, sir. Thank you. Namaste.
Thank you. Namaste.